Merci beaucoup.
Parfait. Alors, je transfère les lignes maintenant. Et tout ce qui va être dit à partir de maintenant va être entendu dans l'appel. Un moment, s'il vous plaît.
Votre demande a été acceptée. Pour annuler votre question, appuyez sur étoile. This conference is being recorded. Cette conférence est enregistrée.
Éric, tu peux commencer.
Merci beaucoup. Hello, everyone. Bonjour à tous. Welcome for participating in today's technical briefing, which will provide an update on the review of AstraZeneca and COVID-19 vaccines. Bienvenue au briefing technique afin de...
Welcome to the technical brief. I'd like to give you an update on the safety of AstraZeneca and COVID-19.
Doctors Supriya Sharma and Marc Berthiaume of Health Canada. Aujourd'hui, nous entendons des allocutions des docteurs
Today we'll hear remarks from both Doctors Supriya Sharma and Dr. Miska.
Nous répondrons à vos questions. If you wish to ask questions, please press star 1 on your phone now. Si vous désirez poser une question, appuyez sur étoile 1. Note that today's briefing is for attribution. Donc, procédons maintenant à la séance d'information technique. Let's begin the briefing. Over to you, Dr. Sharma.
Thank you, Eric, and bonjour, good morning, good afternoon. Thank you for joining us. Today I'm here to talk to you about the AstraZeneca and COVID-19 vaccines and to update you on an ongoing safety review of these vaccines as well as the Janssen COVID-19 vaccine. We know there's a lot of information out there about vaccines and specifically around reports of very rare, unusual blood clots with low platelets in people who were vaccinated. We're committed to being open and transparent with information on the approvals and the monitoring of all vaccines so that Canadians have the most accurate and up-to-date information to make informed choices. Today, we're providing information on updates to the product labels for the AstraZeneca and COVID-19 vaccines to reflect that these very rare events are possibly linked to the use of this vaccine. Vaccines are an important part of our fight against COVID-19 and they are saving lives. COVID-19, as we know, is a very contagious illness with significant rates of both hospitalizations and deaths. Every day in Canada, we are seeing case counts climb and hospitalizations increase. Currently, with COVID-19 being very transmissible, there are people who are at high risk of exposure and serious illness. By contrast, there's a very low risk of experiencing a serious adverse event from this or any of the authorized vaccines. But while serious adverse events may be very rare, we do still take them very seriously. And it's our job as the regulator to do the research, to investigate, and to provide Canadians with the best scientific information possible. Before I say more about our ongoing safety review and the measures we're taking, I want to underscore what isn't changing. Health Canada still considers the benefits of the AstraZeneca vaccine to outweigh the risks of getting COVID-19. And we are not limiting the use of the vaccine to any specific age group or sex. Because all the authorized vaccines have been shown to be very effective at preventing hospitalizations and deaths, we continue to encourage you to get the first vaccine that is offered to you. So first, I'll give you a bit of background. In early March, Health Canada became aware of cases of very rare blood clots with low platelets found in people who were immunized with the AstraZeneca COVID-19 vaccine in Europe and in the UK. Since then, more cases have been reported, although these events are still considered to be very rare. By the end of March, more than 20 million doses of the AstraZeneca vaccine had been given in the UK. Of those, the UK regulator, known as the MHRA, had received 79 reports of blood clotting cases with low platelets following vaccination. This means that based on reports, approximately 4 in a million, or 1 in 250,000 people who received the vaccine reported this rare side effect. Since these rare cases first emerged, Health Canada has been reviewing all the evidence on the safety of COVID-19 vaccines as it becomes available. We've been working with our international counterparts in the UK and Europe to share information and analyses. This is an ongoing assessment, and we will continue to get new information. As of April 3rd, Canada has administered more than 484,000 doses of the COVID-19 and AstraZeneca vaccine. As reported this week, the Public Health Agency of Canada has received a report of a case of an individual living in Quebec who has experienced a very rare adverse event involving blood clots with low platelets following immunization with Covishield. This is the first reported case in Canada, and this person is recovering at home. This report will be considered as part of the department's ongoing safety review of the AstraZeneca and Covishield vaccines and the risk of rare blood clots with low platelets. Sharing of information on all of these reports demonstrates that the global post-market monitoring system for vaccines is working. In addition to the data we have from our initial review of the clinical trials, Health Canada now has real-world evidence of how the vaccines are working after millions of people have taken them. It is not unusual for rare side effects to appear once any medicine or vaccine has been given to a large number of people. This is exactly why we have robust monitoring systems in place. As a result of our safety review, Health Canada has taken a number of actions. So since early March, we've communicated with Canadians several times to keep them informed about the rare blood clotting events in Europe. On the 24th of March, we implemented change to the product label and issued a communication with the manufacturer to inform healthcare professionals and vaccine recipients about these very rare adverse events. And on March 29th, we issued terms and conditions that required AstraZeneca to provide us with additional analysis, including a benefit risk assessment by age and sex. For the safety review, we used evidence that the UK and the European Medicines Agency shared with us, as well as data provided by the manufacturer. We also consulted with key Canadian thrombosis or blood clotting experts on risks, treatments, and possible risk mitigation measures. So after completing the safety review, we've concluded that these very rare events are possibly linked to the use of the vaccine. This conclusion is consistent with that of other international regulators. And as a result, we've updated warnings on the label so that Canadians can be informed of these potential side effects. We didn't find any specific risk factors such as age or sex, so we are therefore not requiring that the vaccine label be updated to restrict the use of the vaccine at this time. Health Canada's findings are based on a sound and thorough review of all of the evidence that's available. In the very rare event that someone experiences unusual blood clots with low platelets, it's also important to note that they can be detected, especially if symptoms are reported early, and that there are treatments available. We've also issued a public advisory today that provides people and healthcare professionals with information about the signs and symptoms to watch for when they should seek medical assistance should this very rare event occur. We will share our conclusions with the National Advisory Committee on Immunization, or NACI, and the provincial and territorial vaccine committees to support their decisions on vaccine rollout across the country. As more evidence about vaccines becomes available, we will continue to actively monitor and assess the safety and effectiveness of all of the vaccines authorized for use in Canada, and will keep Canadians informed about what we find out. Vaccine monitoring involves Health Canada, working in close partnership with the Public Health Agency of Canada, the provinces and territories, and other international regulators and manufacturers to immediately share information on any emerging issue. With respect to Janssen, we would also like to update you on the situation with that vaccine. We are aware that the U.S. has paused the use of the Janssen COVID-19 vaccine as a precautionary measure while it investigates reports of rare blood clots. The European Medicines Agency is also examining this potential new safety signal. This appears to be very rare, with 6 cases of unusual blood clots reported following 6.8 million doses of the Janssen vaccine administered in the U.S. We've already asked Janssen to provide information on any cases of these rare blood clotting events. While the Janssen vaccines are not yet in use in Canada, Health Canada is following this issue very closely and is working with the manufacturer, the US FDA, the European Medicines Agencies, and other international regulators to examine it, and will take any action if necessary. Based on the safety review of the AstraZeneca vaccine, what is Health Canada's advice? We know that the risks of getting these side effects from the vaccine are very rare. And we know that the risk of getting infected with COVID-19 and potentially experiencing serious health consequences, hospitalization, or even death from the disease are very real. Health Canada wants to reassure people that the AstraZeneca vaccine continues to be safe and effective at protecting them against COVID-19, and that the benefits of immunization outweigh the risks. Our best advice to Canadians is always the same, but possibly more urgent now than ever, with cases of COVID-19 increasing across Canada. Get whichever vaccine is available to you. It's that simple. The longer you wait to get vaccinated, the longer you're not protected. Thank you.
Bonjour, je vous remercie de vous joindre.
Hello, thank you for joining us. Today I'm here to talk to you about the AstraZeneca and Covishield COVID-19 vaccines and to update you on our ongoing safety reviews of those vaccines as well as the Janssen vaccine. We know that there's a lot of information out there about vaccines, especially around reports of very rare blood clots with low platelets in people who were vaccinated. We're committed to being open and transparent with information on the approvals and monitoring of all vaccines so that Canadians have the most accurate and up-to-date information to make informed choices. Today we're providing important information on updates to the product labels for the AstraZeneca and Covishield COVID-19 vaccines to reflect that these are very rare events that are possibly linked to the use of the vaccine. Vaccines are an important part of our fight against COVID-19 and they are saving lives. COVID-19, as we know, is a very contagious illness with significant rates of both hospitalizations and death. Every day in Canada, we're seeing case counts climb and hospitalizations increase. Currently, with COVID-19 being very transmissible, there are people who are at high risk of exposure and serious illness. By contrast, there is a very low risk of experiencing a serious adverse event from this or any of the authorized vaccines. But while serious side adverse events may be very rare, we do still take them very seriously, and it's our job as a regulator to do the research, to investigate and provide Canadians with the best scientific information possible. Before I say more about our ongoing safety review and the measures we're taking, I want to underscore what isn't changing. Health Canada still considers the benefits of AstraZeneca vaccine to outweigh the risks of getting COVID-19, and we're not limiting the use of the vaccine to any specific age group or sex. Because all the authorized vaccines have been shown to be very effective at preventing hospitalizations and deaths, we continue to encourage you to get the first vaccine that is offered to you. First, I'll give you a bit of background. In early March, Health Canada became aware of cases of very rare blood clots with low platelets found in people who were immunized with the AstraZeneca COVID-19 vaccine in Europe and in the UK. Since then, more cases have been reported, although these events are still considered to be very rare. By the end of March, more than 20 million doses of the AstraZeneca vaccine had been given in the UK, and of those, the UK regulator, known as the MHRA, had received 79 reports of blood clotting cases with low platelets following vaccination. This means that, based on reports, approximately 4 in a million or 1 in 250,000 people who received the vaccine reported this side effect. Since these rare cases first emerged, Health Canada has been reviewing all the evidence on the safety of COVID-19 vaccines as it becomes available. We have been working with our international counterparts in the UK and Europe to share information and analyses. These are an ongoing assessment and we will continue to get new information. As of April 3rd, Canada has administered over 484,000 doses of the Covishield and AstraZeneca vaccines. As reported this week, the Public Health Agency of Canada has received a report of a case of an individual living in Quebec who has experienced a very rare adverse event involving blood clots with low platelets following immunization with Covishield. This is the first reported case in Canada. The person is recovering. This report will be considered as part of the department's ongoing safety review of the AstraZeneca and Covishield vaccines and the risk of rare blood clots with low platelets. Sharing of information on all of these reports demonstrates that the global post-market monitoring system for vaccines is working. In addition to the data we have from our initial review of clinical trials, Health Canada now has real-world evidence of how the vaccines are working after millions of people have taken them. It is not unusual for rare side effects to appear once any medicine or vaccine has been given to a large number of people, and this is exactly why we have robust monitoring systems in place. As a result of our safety review, Health Canada has taken a number of actions. And since early March, Health Canada has communicated with Canadians several times to keep them informed about the rare blood clotting events in Europe. On March 24, we implemented changes to the product label and issued a communication with the manufacturer to inform healthcare professionals and vaccine recipients about these very rare adverse events. On March 29, we issued terms and conditions that required AstraZeneca to provide us with additional analyses, including a benefit-risk assessment by age and sex. For this safety review, we used evidence that the UK and the European Medicine Agency shared with us and data provided by the manufacturer. We have also consulted with key Canadian thrombosis or blood clotting experts on risks, treatments, and possible risk mitigation measures. After completing this safety review, Health Canada has concluded that these very rare events are possibly linked to the use of the vaccine. This conclusion is consistent with that of other international regulators. As a result, we've updated warnings on the label so that Canadians can be informed of the side effects. We didn't find any specific risk factors such as age or sex, so we are therefore not requiring that the vaccine label be updated to restrict the use of the vaccine at this time. Health Canada's findings are based on a sound and thorough review of all evidence available. And in the rare event that someone experiences unusual blood clots or with low platelets, it's important to note that they can be detected, especially if symptoms are reported early and that there are treatments available. We have also issued a public advisory today that provides people and healthcare professionals with information about the signs and symptoms to watch for and when they should seek medical assistance should this very rare event occur. Health Canada will share its conclusions with the National Advisory Committee on Vaccination and the provincial and territorial vaccine committees to support their decisions on vaccine rollout across the country. As more evidence about the vaccines becomes available, Health Canada will continue to actively monitor and assess the safety and effectiveness of all the vaccines authorised for use in Canada and will keep Canadians informed about what we find out. Vaccine monitoring involves Health Canada working in close partnership with the Public Health Agency of Canada, the provinces and the territories, and other international regulators and manufacturers to immediately share information on any emerging issues. We would also like to update you on the Janssen vaccine situation. Health Canada is aware that the United States has paused use of the Janssen COVID-19 vaccine as a precautionary measure while it investigates reports of rare blood clots. The European Medicines Agency is also examining this new safety signal. This appears to be very rare, with 6 cases of unusual blood clots reported following 6.8 million doses of the Janssen vaccine administered in the US. We've already asked Janssen to provide information on any cases of these rare blood clotting events. While the Janssen vaccine vaccines are not yet in use in Canada, Health Canada is following this issue very closely and is working with the manufacturer, the US FDA, the European Medicines Agency and other international regulators to examine it and will continue to take action if necessary. Based on the safety review of the AstraZeneca vaccine, what is Health Canada's advice? We know that the risk of getting these side effects from the vaccine are very rare, and we know that the risk of getting infected with COVID-19 and potentially experiencing serious health consequences, hospitalization, or even death from the disease are very real. Health Canada wants to reassure people that the AstraZeneca vaccine continues to be safe and effective at protecting them against COVID-19 and that the benefits of immunisation outweigh the risks. Our best advice to Canadians is always the same, but possibly more urgent now than ever, with cases of COVID-19 increasing across Canada. Get whichever vaccine is available to you. It's that simple. The longer you wait to get vaccinated, the longer you're not protected. Thank you.
Dr. Bastien, we will now open the line to questions. Vous pouvez poser vos questions dans l'une des 2 langues officielles. We ask that you limit yourself to 1 question and only 1 follow-up. We'll now start with the first question. Operator, over to you. Opérateur, à vous la parole.
Thank you. Merci. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 pour poser une question. Notre première question est de Raymond Fillon de TVA.
TVA, the floor is yours. Yes. Hi there. Dr. Berthiaume, could you please tell us the age of the woman that had a blood clot in Quebec, and did she have an underlying medical condition that could explain what occurred? That information is currently being reviewed. Therefore, we can't disclose any information for the time being. But this particular case will be reviewed. We can't give specifics about cases because we have to protect confidentiality, especially since there are very few adverse events. But the case will be rigorously assessed based on the data collected to determine what the risk factors were and if there's any information we can derive from this case. What I can tell you is in Quebec, there have been 160,000 AstraZeneca vaccines administered with only one case of this adverse effect.
Seulement un cas rapporté de cet effet.
And only one case across Canada of this blood clotting case with low platelets. So therefore, the frequency seems to be in line with the information that we're getting from the European Medicines Agency in the UK. You said the AstraZeneca vaccine is safe and effective to your mind, and that you haven't determined that there are any risks associated with sex and age. So why do you continue to recommend that the AstraZeneca vaccine not be administered to those Canadians under 35 years of age? Response: Health Canada, when as far as vaccine use recommendations are concerned, are not recommending any restrictions in terms of the AstraZeneca vaccine. The key indicator is whether or not AstraZeneca is working to prevent COVID-19 and the serious complications from COVID-19. Based on real-world experience and clinical trials, this vaccine is effective and efficacious. We have received reports of very rare adverse side effects and adverse events. So as far as age and gender is concerned, there doesn't seem to be any heightened risk from taking the AstraZeneca vaccine vis-a-vis other vaccines. That said, there is the Public Health Agency of Canada, as well as the National Advisory Committee on Vaccination, that provides advice to the provinces and territories as to how to roll out vaccines across Canada. And then it's up to the provinces and territories with their public health ministries to take consequent decisions. Therefore, NACI has recommended the use of the AstraZeneca vaccine for over 35-year-olds. And they don't only factor in the notion of a vaccine or no vaccine, but what vaccine should be used for each different population to have an optimal effect, and what the ideal profiles are in terms of risk-benefits analyses. So there is this kind of in-depth reporting that informs decision-making in the provinces as to how to optimise rollout of vaccine across Canada. Health Canada hasn't established a restriction based on age. NACI, however, has recommended that 35 and over, those in the 35 and over age group could safely use AstraZeneca because risks increases with age. So it does appear that the risk of side effects does increase with age. But among the young population, this kind of adverse event is extremely rare. Thank you very much.
Thank you. Our next question is from Annie Bergeron-Oliver from CTV National News. Please go ahead. À vous la parole.
Hello, thank you for taking my question. I'm just wondering if you can provide a point of clarification. I believe the doctor who was just speaking mentioned that NACI has recommended AstraZeneca to 35 and over. Is that new? Because as I had understood it, it is not recommended for people under 55. So can you clarify that for me?
Right. So Dr. Berthiaume was saying was, first of all, he was sort of making sure that there was an understanding of the differences in terms of the roles and responsibilities between Health Canada as the regulator, so looking at what we say safety, efficacy, and quality, benefits and risks of having the vaccine versus not having the vaccine, and then the recommendations that are provided by the National Advisory Committee on Immunization to the provinces and territories about the optimal use of the vaccine, which includes potential alternative vaccines, and then of course taking into account the current epidemiology around COVID-19. And you're correct. So NACI at this point in time had recommended the use of AstraZeneca for people age 55 and above. NACI is also meeting now again to take a look at those recommendations to see if they need to be updated. Health Canada has presented to NACI, so all the information that we looked at to make our regulatory decisions have been provided to NACI, and they will continue to look at that and see if there's any change to the recommendations. But currently, their previous recommendation stands, so they were recommending the use of AstraZeneca for those age 55 and above.
Thank you. Follow up?
Thank you for that. Thank you for that clarification. In your opening statement, you mentioned that there had been more than 400 doses of AstraZeneca that had been delivered. Online, it says that there are more than 484 doses have been delivered, but that's as of April 3rd. Health Canada says they don't have any updated information over the last 11 days. So, one, why don't you have more up-to-date data on exactly how many AstraZeneca doses have been doled out? And two, how can Health Canada understand what the risk is to Canadians when they don't know how many doses have been delivered?
So, the reason that we use the numbers that we have, so the 484,000 doses administered, is because that's what we were using when we were, at the time we were doing our analysis. That is a point in time. We absolutely, through the Public Health Agency, have additional information on the numbers of doses that have been administered, and that's actually made public by the Public Health Agency on a regular basis. So I don't want to leave anyone with the impression that we don't have that. So they are compiling that, and they
don't have any updated information. They said that
right,
was the most recent when we asked, and they don't have any data over the last 10 days.
Right, and so my understanding is that they are getting that data, and then later on this week they'll be able to provide that. So I think it was that they weren't able to provide that at this point in time, but they certainly are bringing those numbers together, and then they'll disclose it. It's usually on the Thursday call, and then overall, what we're looking at is obviously numbers of doses, but numbers of if we have any cases, and we only have, I shouldn't say only, we have one case in Canada, so that number, obviously is very small compared to, whatever the doses are that we've delivered. And that's why, of course, we need to look at things in the Canadian context. But we are looking to the work that we're doing with the United Kingdom, where millions of doses have been administered, European Union, where millions of doses have been administered, and those numbers as well. So as we said, when we're looking at any adverse event that's very rare, we really are looking at all the data that we can to put that into context.
Thank you, Dr. Sharma. I would like to remind that it's one question and only one follow-up. We'll take the next question. Prochaine question. Opérateur.
Thank you. Our next question, notre prochaine question est de Catherine Lévesque de la Presse canadienne.
Catherine Lévesque, La Presse canadienne. The floor is yours. Yes, hello, doctors. Dr. Berthiaume, if we've understood correctly, well, what is actually changing as of today? I understand that the labelling is being changed and recommendations to physicians, but Health Canada isn't changing its recommendations vis-à-vis AstraZeneca in any other way. Is that correct? Response. Well, you're right. Our basic core decision has not changed. We believe that for all age groups, the benefits of being immunized with AstraZeneca against COVID-19 outweigh the risks of not being vaccinated. That said, we have made changes to the labeling and also the precaution advisories or notices. So that information now stands out more on the labels. It used to be in the fine print, and now, since these cases have been reported, we have established the link as being valid, and therefore the information stands out more now on the labeling. So therefore the information hasn't really changed, but the information stands out more on the labeling, and physicians are being advised accordingly.
Puis, est-ce qu'on en comprend que
So is the takeaway from that given the most recent information, NACI might in fact end up changing its recommendations for under 55-year-olds? And do you get the sense that that might actually occur? Response. Well, there are a number of NACI members who have said that in the upcoming days, based on the scientific data provided by Health Canada and their own analysis, that they might in fact amend the recommendation. And the co-chair yesterday intimated that it may or may not have to do with a change to the age-related recommendations. But that's up to NACI. But what I can tell you is that they are currently reviewing their initial analysis. And Health Canada's information has been shared, of course, with NACI so that they can make the well-informed recommendations. But once again, Health Canada looks at the risk-benefit analysis of a product, its efficaciousness, its safety. There is a peer-to-peer assessment of other similar products done, and we determine whether the risk-benefit profile needs to be reviewed. And therefore, these are two parallel roles, and I think that some of the public's confusion has to do around with the fact that Health Canada is doing one thing and NACI seems to be saying another thing, but they play a complementary role, as I just said. And any risk analysis, as I said, is complementary. But we're working together toward the same goal, and that is to ensure the health and safety of Canadians and combat the COVID-19 virus. That's why we're trying to be as clear and transparent as possible in explaining the roles of both organizations. Thank you very much, Dr. Berthiaume.
Robson from the Canadian Press. Please go ahead. À vous la parole.
Yeah, good morning. I'm wondering if you could talk a little bit more about the incident rate, because the numbers seem to be different depending on who you get them from. Denmark said today they think it might be 1 in 40,000. Germany said 1 in 100,000. You're saying 1 in 250,000. Do we have any sense of why these numbers are all over the place?
Right. Well, I think first of all, these aren't incidence rates. So when we talk about incidence rates, it's really, the incidence of that event happening in the population. I think the first thing to talk about is that we're dealing with reporting rates. So reporting rates means that somebody has seen an adverse reaction, has made an association that it possibly could be related to the vaccine. It's within that period of time, and then reported it in. So I think that's one part of it. And that's the reason that you're seeing different numbers, because depending on the country, if they're looking at the numbers of reports they're getting over the numbers of vaccinations that they've done, when they're looking at the cases over the numbers of vaccinations, that can vary. And when you're seeing very small numbers of cases and very rare events, a change of 1 or 2 cases can actually make a big difference in terms of the overall reporting rates. We're using the 4 in a million because we feel that the United Kingdom data set is the one that seems to be the most complete. So they've delivered the most doses of AstraZeneca. They have a very good post-market monitoring system in the UK, and they actually have a good central database in terms of the numbers of vaccinations that were delivered and where they were. So that's why we're using those data. I think in general, if we're looking at a range, most people are coming to the conclusion that it's a range of between 1 in 100,000 and 1 in 250,000. But again, those numbers will shift as we get more cases and get more information. But because they're very small is why we're seeing those differences.
Perfect, thank you. And I'm also wondering, so I think you were answering a little bit about what was changing today in French to Catherine, but you said that you updated the label on March 24th, and yet you're updating it again today. I'm wondering if you can explain what changed then versus what's changing now. And also, last week I was hearing from people who got the AstraZeneca vaccine in Ontario in particular, who were given zero information about the risk of blood clots. And I'm just wondering what you are providing and what provinces should be providing to patients when they get this vaccine, so they are both making an informed decision to get it and also know what to look for afterwards.
Absolutely. So where we were when we first heard about these rare events is that we knew that that they occurred. There wasn't necessarily a link between the vaccine and those adverse events at that point in time. So we did initially we updated the product monograph just to reflect that these reports had happened. And it was very similar to what we did for allergic reactions. So we said that at that, the early point in time that there had been there is a risk of it, but there hadn't been any reports. When we did have real world evidence of reports, we've added that. What we're changing today is that we feel that there is a stronger link between these adverse reactions and the vaccine itself. And so we've changed it from, that there are some reports out there that may or may not be associated with the use of the vaccine to we believe that we've moved them to the section on the warning. So we've created a section in the product monograph that talks about thrombosis or clots with thrombocytopenia or the low platelets and provided information about the cases that we know about. In addition, in that section, we do say that if somebody has had what we call a central venous sinus thrombosis, so this unusual clotting reaction that's in the veins around the brain, or if they've had a reaction that's similar to what we think is the mechanism for this, which is a heparin-induced thrombocytopenia, so that's clots with the low platelets, that they have that discussion with their practitioner about whether or not they should be taking this vaccine. And we've also added information to say, if you are a person that has had this reaction, so if you've had the AstraZeneca, the COVID vaccine, and you've had this very rare reaction of an unusual clot and low platelets and it's been diagnosed, then you should not get the second dose. So that's what's changed, but that's why, in the opening remarks, we wanted to make sure that we've highlighted what hasn't changed, right? That the benefits still outweigh the risk. This is still a useful vaccine in terms of a tool in our toolkit, so we wanted to say that. The second part in terms of information to both people that are getting the AstraZeneca vaccine as well as practitioners. I mean, we have put the information out about what to look for in terms of signs and symptoms. And I think the fact that we, this one case that we have in Quebec, the fact that people did recognize that this was an unusual clot that could be associated with the vaccine, it was diagnosed, the appropriate blood work was done, the appropriate treatment was given, and that person is now recovering is part of making sure that it's a sign that the system is working in terms of getting that information out there, even before we had even one case in Canada. Now, we realize that, of course, as the vaccines are rolling out, we want to make sure that all that information is available. So we have that information on our website. All the updates in the product monograph are on the portal as well, the Health Canada portal for vaccines. We've worked with Thrombosis Canada to put additional information on their website. We put out the public advisory. There's certainly a lot of work that's being done with other groups on clinical practice guidelines. So we know in Ontario that the Science Table has put together, what to look for and how to treat, and so that's available as well on various websites. We've also, today put out a public advisory, again, sort of stating what we've done in terms of the changes to our product monograph, and importantly, to note the signs and symptoms of what you might look for in that period. So from 4 to 20 days after you get that vaccine, if you have a really serious persistent headache, if you have persistent, serious abdominal pain, if you have, pain in your limbs that's quite severe and persistent, if you have any unusual bruising other than at the site of the injection, those are signs that you should be seeking medical attention. And again, when we're talking about things like very severe headaches that continue and are persistent, or very severe abdominal pain that's continuous, those are things that you should be seeking medical care for, anyway. So we are trying to put as much information out there. Obviously things are evolving quickly, and certainly we've talked about the National Advisory Committee on Immunizations providing information to the provinces and territories, and the provinces and territories putting out information. So hopefully with that concerted effort, all of us working together, the most important thing is that Canadians have that information. There's a lot of information out there. There's a lot of noise.
The floor is yours. Yes, I'd like to come back to the risks associated with this vaccine. We are overwhelmed with a lot of data here. 4 out of 1 million cases, then we have 4 out of 400,000 or 60,000 in Quebec. So, Dr. Bertium, when you tell us that, in inverted commas, you've collected all the international studies and you have reached your findings based on all of those studies, can we in fact provide an accurate figure as to the risk of the AstraZeneca vaccine? Response: absolutely. The age that I referred to in my opening remarks is such that, the most reliable data that we have seen to date, given the number of cases reported versus the number of persons inoculated, is the data from the UK because of the quality of their medical records and the collection of adverse events. So it's one adverse event of rare blood clotting out of that particular grand total. As I said, in Quebec, there are 167,000 vaccinations with COVID-Shield and one single case of this rare blood clotting with low platelets reported. So were there to be no further cases, well, it would be compatible with information coming from elsewhere. Now, in Canada, there have been over 450,000 doses distributed and one single case observed. Now, were there to be a second case reported, well, that would change and skew the data, wouldn't it? So there's always a little bit of a variance when it comes to this data, which is constantly evolving. But the message that comes out of this, the takeaway, is that Health Canada has looked at various data sets, various experiences, real-world experiences across the world, and given the rare occurrence of this rare blood clotting, then we can safely surmise that it is 1 out of 250,000. As a follow-up, what about specific studies you've requested from the company about any adverse side effects to do with age or age groups? I imagine those results haven't been collated and crunched yet, but once that is done, I imagine you will be able to make a recommendation as to the various age groups. And do you think that things might vary at that point in terms of your recommendations? Well, yes, everything is possible at this stage of the game. As I said, this is a constantly evolving situation, and we're kind of chasing the data, if you will. Now, if, for example, there was additional information that came to light where there was a risk group identified to do with gender or sex or comorbidities, then we could take additional measures. But what I can tell you currently, if we look at the real-world experience internationally with AstraZeneca, we've had 25 million doses administered across Europe, and we have solid data sets in terms of the side effects and positive effects of this vaccine. So over time, as more and more data comes in, and as our estimates and forecasts actually turn into real data, we may not be making that many changes. But that said, we do seem to have fairly robust evidence in terms of identifying adverse events. But as I said, the data continues to come in, and if we end up having to change our position, we will do so. Our overall objective is to keep Canadians well informed about our decisions and what our decisions are being based on. And if we see that there is a particular problem with a particular vaccine, we won't hesitate to take the regulatory action necessary at that time. Thank you very much, Dr. Bertium.
Next question, please.
Thank you. Our next question is from David Thurton from CBC News. Please go ahead. À vous la parole.
Hi, yes. My first question is just this. Maybe it would be helpful if, Dr. Sharma, you can tell us how the risk of blood clots, from AstraZeneca compares to other things, such as maybe, birth control or other things such as smoking. Is there any way you can kind of break that down in an understandable way so Canadians can understand the risk of taking AstraZeneca and how it compares to other risks that we encounter day to day?
Right. So, this is always a challenge, and I've seen the comparison in terms of clots associated with birth control pills, comparing that to what we're dealing with respect to these unusual clots with low platelets. And so the first thing that I wanted to say about that is that, it is difficult to kind of wrap your head around these large abstract numbers and relative risks. So that's the first part. We understand that. The second part of that is that it's really important to compare apples and apples and oranges. So with respect to the numbers that we've seen with blood clots and, the birth control pill, for example, those are not the same types of clots that we're seeing with the vaccines. So, and maybe just to take a moment on that, it's also that, so if you're a woman between the ages of 15 and 45, your risk of a blood clot is around 1 in 3,300. If you take a birth control pill, that goes to 1 in about 1,600. Some of that is just background rates, just the natural sort of incidence. If you are pregnant, it goes to 1 in 300. If you are right after your pregnancy, it goes to 1 in 100. If you are in hospital with COVID-19, your risk of having a serious clot is 1 in 5. So I think we just, if we're talking about clots in general, and we're talking about the sort of the risks and benefits in that area, obviously the risk of clots with regular clots with COVID is much, much, much higher than with other things that we talk about in terms of benefits and risk. And it's much, much, much higher than having this very, very severe clot. So then let's look at the types of clots that we're dealing with. These are extremely, extremely rare. And again, we're using 1 in 250,000 as an estimate. We look at what, another thing that it's like. So one of the hypotheses about what's causing this is really an activation of the immune system that then leads to platelets, these clotting things being activated, causing clots, and then because those platelets are consumed in the process, the overall count goes down. It's likened to what we see with heparin. Heparin is a medication that seems to trigger the same type of reaction. We still have heparin on the market, right? We still use it. We still use it for prevention. We use it in syringes, for example, to prevent clots, even though there might be alternatives to it. So it is, we have to look at, I think it's helpful sometimes putting in context with other types of clots, but really the thing that we're looking at is this very, very rare chance of having this severe clot that you can diagnose and treat, and potentially getting sick with COVID, getting seriously ill, potentially dying, and all of the other effects that could occur with COVID. And for all of the age groups, especially when we're in the situation where the risk of COVID is moderate or high, as it is in many parts of the country, the benefits of the AstraZeneca vaccine far outweigh the risks in all age groups.
Thank you. Follow up?
Yeah, no, thank you for that explanation. That really helps, at least in my mind, to clarify things. I wanted to get some clarification on something that Dr. Bertium said about NACI possibly considering changing the age eligibility for AstraZeneca. Did I hear correctly that it might change to 35 and over? Either Dr. Bertium or Dr. Sharma.
Yeah, so just to say, I think
Supriya, if I may, maybe I misspoke. Just want to clarify for the benefit of all of the audience. Maybe I did a lapsus in French. I never meant to say 35. If I said 35, I meant to say 55. So sorry if there was a mistake. I'll have to look at the recording to see what I said. But in my head, I said 55. So just want to be clear for everyone.
All good.
Thank you.
So I think, but just to clarify, so NACI is Yeah, NACI is looking at it. Again, we presented our data to them, so they have the same summary data that we looked at, and then they will be providing their recommendations. So that may include a change in age, or they're relooking at the age, but also their overall recommendations about the optimal use of the AstraZeneca vaccine in the context of the current epidemiology, as well as the availability of alternatives. But but right now, their recommendation is still the same: AstraZeneca for use in people ages 55 years and older. That does not mean that it cannot be used in younger people. It is a recommendation. It certainly is up to the provinces and territories. There have been other times where NACI has made recommendations, and provinces and territories have decided to use either vaccines in different ways. So again, I think it's the public health side of things, making recommendations to the provinces and territories. And the other thing that I just wanted to sort of stress is that we're seeing this in all countries. So almost all countries have a Health Canada equivalent as the regulator, and a NACI equivalent as the body that provides recommendations on the optimal use of the vaccinations. On the regulatory side, so the comparable organizations from Health Canada, all of the regulators have basically been in line. They've noted that this might be an adverse event. They've noted that it's very rare. They've noted that they're continuing to follow up on it, but they haven't restricted the use to a certain age range or sex. But we do see in the public health side of things in the recommendations that different countries have taken different approaches on the rollout and the use of the vaccine based on their current local circumstances.
Thank you very much. We have time for one last question. Une dernière question. Opérateur.
Thank you. Our last question is from Ryan Timothy from National Post. Please go ahead. À vous la parole.
Yeah, I'm wondering if you can help me understand how health regulators, including yourself, quantify risk, because you're talking about a risk of 1 in 450,000 of these rare blood clots, and we still have this age restriction in place on the use of AstraZeneca. And as you said a few times now here, the risk of dying of COVID is much higher than that. I think for a lot of lay people, it's hard to understand, especially with the news about the pause of the Johnson & Johnson vaccine as well, why you would take the drastic step of halting vaccinations for these vaccines when the risk of COVID is so high and the risk of these clots is so low.
Right. So maybe I'll speak to the Johnson & Johnson pause in the United States first. So just to say that again, the regulator, the US FDA, has not changed their authorization of the J&J vaccine. It's the public health side that recommended a pause for a few days while they do two things. One is that they're convening a committee to take a look at those cases, but more importantly, they wanted to make sure that they gave people that were considering getting the vaccine information and the healthcare practitioners information. Now, in Canada, that's what we did as well. We provided information before we even had a single case. So that's what they're doing. And again, it's a temporary pause for a few days to do that assessment and to get a chance to communicate on that. So that's their decision. On the overall benefits and risks, this is where I can understand where there can be some confusion. So as we said, on the regulatory side of things, we look at the overall benefits and risks. If we feel that at any point in time the risks outweigh the benefits, we would stop the authorization of the vaccine and would say it cannot be used at all in Canada. That's a legal authorization that carries a certain amount of weight. We would do the same thing if we found a certain age group where that risk was much higher. Now, that's not the case. The recommendations on the public health side of things is not really on the risk of having this adverse reaction as much as it is on the risk of potentially having COVID, getting seriously ill from COVID, and having serious adverse events associated with that, or the risks. So it's not, again, there's very little change in the risk of this actual very rare adverse reaction from one age group to another, but there are significant differences in terms of COVID-19 and how they're affected. I think what we're seeing now is that we're seeing some shifts and we're seeing some changes in that epidemiology in Canada. And so that's exactly what NACI and other groups have to take into consideration. So for any individual, you have to take a look at their individual risk of getting COVID-19. So that's a combination of being exposed to it and then potentially having serious adverse events associated with it, hospitalization and death, and whether or not there's a vaccine available, which vaccine is available, and the benefits of that. So that's why it really is, like, I absolutely understand that everyone wants the quick sort of what's the bottom line, what's the hot take on it, but it is more complicated, and it is based on risks and benefits for different groups, for different individuals, availability of vaccines, and what we're seeing in terms of COVID-19 cases and incidences in across the country, and that may vary from place to place as well.
Thank you. Follow-up, Brian?
Yeah, just as a follow-up, I know you said that you're limited by privacy rules when it comes to revealing the person, the age of the person who has seen these rare clots. I'm wondering if you can say, though, whether or not the person who received it is younger than 55. Basically, do they fall within the current restrictions for the vaccine?
So the individual was a woman, and she was over the age of 55. We will not get any more specific than that because, obviously, with a small number of cases, with one case, you can potentially identify the person. So just to say that, and the person did not have other risk factors for this type of clot. And again, it was picked up, was diagnosed, the appropriate lab tests were done, the appropriate imaging was done, she received appropriate treatment, and is now recovering at home.
Thank you very much, Dr. Sharma. That will be all for today's technical briefing. C'est ce qui met fin au briefing technique pour aujourd'hui. Passez une belle journée. Au revoir.
Merci.